Thank you all so much for joining us today. My name is Lisa Cote, and I am the Assistant Director of Diversity, Equity, and Inclusion in the Office of Diversity and Community Engagement at the University of Hartford. So we thank you all so much for joining us today. We thought this was a very important topic to discuss, being that everyone in the world at this point has been impacted by the COVID-19 pandemic, and it has highlighted many disparities and challenges that folks are dealing with, including mental health and some specific disparities in healthcare and in communities dealing with those mental health challenges that have been presented by COVID. So we hope that today from our wonderful panel of experts that you will all gain some information to help broaden your thinking and also potentially to help navigate some of these spaces when working with colleagues and students. So it is my honor to introduce our moderator, Dr. Anthony De Jesús, who is an associate professor in the Department of Social Work and Equitable Community Practice and director of the MSW program at the University of St. Joseph in West Hartford. He has been an awesome partner with our university and has presented for us before, and we are so lucky to have him moderating today. So Anthony, I will turn it over to you now. Thank you so much.
Thank you, Lisa. Good afternoon. Buenas tardes, everyone. I'm delighted to moderate this panel with my colleagues, and we'll introduce them. Dr. Noel Casiano is an assistant professor of psychology and human services at the University of Hartford's Hillyer College. He teaches courses in psychology and the newly formed human services concentration. Kirsis Dipre is a visiting assistant professor in the Department of Counseling and Applied Behavioral Analysis in the School of Interdisciplinary Health and Science at the University of St. Joseph. She's completing her PhD in counselor education and supervision at Syracuse University and received her MA from the Family Institute at Northwestern University. She's a certified mental health counselor with expertise in clinical mental health and multicultural counseling, and her research explores the mental health of Latinx, Afro-Latinx, and other marginalized communities through an intersectional lens, in addition to examining mentorship of counseling students of marginalized identities. Jocelyn Flores, LCSW, is a bilingual and bicultural licensed clinical social worker. She is the founder of Open Space Therapy, LLC in Connecticut. She offers virtual outpatient therapy to individuals and families, as well as supervision to candidates planning to pursue their LCSW. Prior to starting her private practice, she was a clinical supervisor in the outpatient department of a nonprofit mental health agency for families and children. She is an alumna of both the University of Hartford and the University of St. Joseph, where I'm proud to say she earned her MSW. So we've got a great panel here of Latinx, Latino, Latina clinicians and scholars who are passionate about supporting the mental health needs of the Latinx community, both in community-based settings and in institutional settings of higher education. As a panel, we've come up with 4 questions that I'm going to pose, and each panelist will respond to the questions from their area of expertise. The first question is, please discuss the current research on the impact of COVID on mental health for the Latinx community. Please provide your research or practice perspective on the clinical impact of COVID-19 on Latinx clients. And we'll begin with Kirsis, followed by Dr. Casiano and Jocelyn.
Well, I just wanted to start by saying thank you all for coming. I'm really excited to be here and be a part of this panel. And I just wanted to say that this panel is important to me because it really is something that I've seen in the literature. We do not emphasize our Latino, Latinx community as much as we should. So I'm hoping that everyone attending today will be able to really get something and, get their little motivation to do a little more for our community so that we can really help our community and be better and have better mental health. So with that being said, it's important to emphasize how, there's different impacts for the mental health of the youth and then adults in our community and just in general. So interestingly enough, when I was really preparing for this, I had this idea that yes, it does impact everyone negatively, but actually for the youth, very young adolescents, for example, the pandemic has had a positive impact when they have stayed and followed the mandates for staying at home, for example. So there's the possibility that there is a protective factor that the pandemic could have for young Latinx youth, for example. When it comes to adult Hispanics or Latinx people, I don't know how many of you have looked into some information related to the COVID impact survey, but this survey really looked at the entire US population. And the researchers did find that for Hispanics specifically, COVID-19 had a detrimental impact completely. So Hispanics, Latinx people reported much worsened mental health symptoms and in the day-to-day lives, for example, and that these symptoms are related specifically to financial struggles and then just worsened overall health. And then the last piece that I want to highlight really, it's about that COVID-19 has not really impacted people when it comes to the cases reported in a specific area, but it is when the people have personal contact, either being diagnosed with the virus or have family members or friends who have been diagnosed with COVID-19, that's when it really influences their mental health. So I think that it's really important for us to think about how we need to really dissect the information, what is actually going on, and not just take an overarching kind of, it has an overall negative impact. It does for the most part, and there's specific elements that are contributing to the negative mental health of people. And then when it comes to my research specifically, I have not been practicing, but I do research related to the mental health service use among our population. And I take a different approach in terms of just thinking about people's skin color and their racial identity and how across the Latinx community, those who have darker phenotypes and darker skin color use mental health services less. And this is something that is seen even with COVID-19. So I'll keep it short and I will leave it at that. Thank you.
Thank you, Kirsis.
Oh, okay. It's my turn. So welcome everyone to University of Hartford. For those that have not been on campus, we hope one day that you'll have an opportunity to visit our beautiful campus and be our guest. But when looking at the research that is currently out there, right? We know we've been in this pandemic for about 2 years. And when I started doing my literature review and looking at the research that was out there, obviously we know that with research, you need kind of that longitudinal kind of data collection process to be able to see impacts. But we're already starting to see with the research that's out there, and I'll be sharing some different articles that I was able to find to kind of highlight my points, is when it comes to the impacts of COVID-19 on the Latino community or Latinx community, one article that I saw that was really kind of like hit home because I kind of experienced it myself, is how as a Puerto Rican, right, and having a large Puerto Rican family, right, I come from like 4 uncles, 4 aunts, I don't even want to know how many number of cousins I have. We're a very large family, and family is really big and really important to the Latinx community. So this article was talking about how COVID-19 really did had some negative outcomes when it came to managing stress and isolation. So imagine these stay-at-home orders. You can't have family members. I have family members that live in Florida, New York, and different parts of Connecticut. They can't come together for the holidays. So isolation was really, really big, and it had a negative outcome on the mental health of Latinx families. But then managing stress, and then this one particular article that I found called Responding to COVID-19 Through an Integrated Kind of Primary Care Behavioral Health Approach. There was something that I saw there, and the top 3 areas where Latinx families really reported concerns. One was managing anxiety and stress. The second most was family concern, right? Being concerned about the health of your family and the well-being of your family. And the third was social determinants of health. So when we start to look at that, now we're starting to see the kind of baseline that we can continue to do ongoing research to see the negative outcomes or impacts due to COVID-19. And again, I'm very big on relationships. When individuals are not connected in a healthy way, that individual is going to struggle psychologically, emotionally, and even physically, right? So there is really kind of great positive impact when we are together, when we are in the classroom, sitting in the classroom together, when we're at home with family, and when we have extended family come over and just kind of celebrate all the things that we love to celebrate together as a familia. So, I'll leave it there, but there's a lot more that I will be also sharing. But again, the primary impacts is, again, managing your mental health and also managing isolation.
Thank you.
Thank you for having me as well. I'm happy to be here. So I think I can go a little deeper into what Noel was mentioning too, of how much family and even just people in general, right, means to our sense of comunidad, right? So maybe I like to sit outside and have coffee with the neighbor, or, talk to other people around me. I saw a really big difference in that, in people feeling alone, isolating, even unfortunately when family members or friends passed away, not being able to do funerals as we've been used to. Spiritually, not being able to gather with our religious or spiritual communities, right? And then thinking of, I think, how common it is sometimes for our Latino and Latina families to have multiple generations living together, right? And now we're all home together all the time, which definitely increases stress as well.
The next question is, what barriers to services have been most prevalent for community and campus-based Latinx populations? Has COVID accelerated existing barriers to treatment? Has the policy response to COVID created any opportunities to address these barriers?
Yeah, well, I guess I can jump in and just kind of share what I, as far as barriers, not only to our community, but to our student population. I've, again, knowing many behavioral health kind of leaders in our community and looking at just the struggles that our community already had as far as access to care and behavioral health care, COVID just made that just more complicated with, let's say, less availability of Spanish-speaking clinicians in agencies and clinics and hospital settings, all the way to even on campus when you think about university and college supports as far as mental health, and really recognizing that we have to do a lot more work when it comes to that. But recognizing that the amount of distress or emotional dysregulation in our community with our community members and our students, we have to be able to kind of think a little bit more progressively as far as how we're going to meet the demand. And we started to see that specifically the research that's out there is pointing to the need for colleges and university to maybe look and assess at the level of supports that they have, mental health supports on campus, because the number of students coming forward to be able to seek services and supports obviously is overwhelming our college and university behavioral health kind of support system. So there are ways that, and I think later on in the chat, there's a White House briefing that I would like to share. There's some funds that are going to be made available so that there can be school-based related mental health supports for our children in elementary, middle, and high school, but also for college and universities to be able to tap into funds to be able to hire Spanish-speaking, bilingual, bicultural staff to be able to meet the demands of our student population, because we're seeing that right now universities and colleges are overwhelmed with the number of referrals that either self-referrals of students coming forward or faculty that are referring students for X number of reasons. So a lot of what's going on is that students are now being referred outside of the university and college campus environment to outside providers where there's already kind of a big gap as far as meeting the demand of the community already. So we have to do and look at what are the best ways that as a university, as colleges, how can we better support our students so that their mental health needs are met so that they can be academically at their best to be able to achieve their overall academic goals. And then on the behavioral health side in our community, we already know that we don't have enough Latinx behavioral health providers. So hopefully people that are here attending will be inspired to enter this field to be able to better meet the needs of our community through behavioral health services.
Kirsis.
Okay, so I would like to build on that. That is a lot of what I was planning to say, and I think it shows that this is a huge need that we have. But I also think that, when you think about our Latinx community in general, students or not students, there's the research points to specific kind of barriers that it could be from accessibility. For example, when you think about a college campus, how many sessions can a student attend before they're referred out? That's a huge barrier, because you have to go after a certain amount of session to build that trust and get into that space again. So that's a huge barrier there. And even for those who are not in college campuses, like how far do you have to travel to get to those services? Do you have the financial resources? Do you not? Are you insured? Are you not? We also think about individual level factors, so the level of stigma that this person carries with them. When we think about the Latinx community, it's not like we just willingly walk into a counseling session. We're told, habla con tu papá, go to church. Like, you have to talk to someone else, but you don't take the family problems, you don't take them outside. So there's this huge cultural stigma around mental health that we need to address and acknowledge. And then in addition, people's perceived need of services. We tend to minimize our struggle. We come from a culture that is very much work hard and keep going, keep pushing. How far can you push? So you may need services in this moment, but you're thinking, no, I don't, I'm still good. And by the time you realize it's too late, there's not a lot of support. So I'm thinking about those barriers that come into play a lot for members of our community. And then I also think about how COVID has multiplied those barriers, not only because, there's increased isolation, as Noel was talking about, but there's a lot of misinformation. that has been going around, even around COVID and the vaccine. There's a lot of misinformation about mental health services. So how primed are we to really taking in the correct information when there's so much more out there that we don't have the ability to kind of take the time? We don't have the time. Let's talk about that. We have to work 9 to 5, go to a family, make meals for the family, do all these things. So people really don't have the time and space to sit through and understand what their mental health needs are and what the mental health needs of their family members are. So it's a lot of just autopilot, and that does not help, and that's a huge barrier in itself. And then we're thinking about economic stress, like I mentioned before, in addition to immigration stress. If you are not an immigrant in your Latinx household, chances are someone in there is. And that influences the family dynamic, that influences everything that is going on. And that is another level of stress that is not typically addressed or talked about. We think that just because you're Latinx, Latino, you're experiencing life in the same way, and it's not. So it's really important to think about those barriers. And unfortunately, the weight has fallen on practitioners. At the policy level, it is very slow. I have not seen changes. I want to see those changes. It's upsetting because there's so much that could be done and needs to be done. And the practitioners are the ones that have to carry that weight. The community has to do that too. And it's very difficult. And I'll talk a little bit about how this weight could be lifted through university settings and partnerships. But I think the barriers just keep getting worse, and it keeps falling on practitioners who also need help to maintain this system.
Jocelyn.
So from a practice perspective, I saw some barriers, some which I think we've learned to navigate because we've just had to adapt, but some which, although they may have passed, made a huge impact. So I'm thinking, right, immigration status, work status impacting. If you're an essential employee, now you still have to go to work and you're putting your family at risk, but you have to go. Or if your place of employment is closed, you might not have access to the benefits which other people are having because of your status. So that was one. Another one is working with children and families at the time, the transition, right, to virtual learning. And a lot of things that came out in emails of this is how you log on to Zoom or whatever, was in English. And whereas we might have access to walk into the school and speak with someone in the school who we've created this relationship with that knows Spanish, this person knows my family, how do I do that? We've now lost that, or in order to attain it, it's not as easy. And then I'm thinking childcare as well, right? So with being essential employees, what happens, and I know this happened across the board with other cultures too, but what happens when parents have to go to work and the daycare is closed, or again, we don't have that same access to family because of travel restrictions and things like that. And as an employee, as a person in the field, I think it had a big impact because we moved much more into having to do a lot of case management, a lot of let me connect you to these resources. This is how you can access that, right? So not only are there a few of us, as Noel mentioned, now we're taking on a lot more. Thankfully, some of the barriers we were able to overcome. I mean, my practice is fully virtual. So in that sense, it's been a benefit, but not everyone had access to the internet immediately, right? Or has access. Another thing with being virtual is that you lose that sense of privacy that you might have with coming into my office. If you're having, for example, problems in your relationship, your partner may be in the other room, right? You may have to now go to your car or figure out how you're going to do that. We've had to get really creative.
Yeah, and also let me point out some other things that I'm pretty sure there's hopefully some university and college administrators that will be viewing this. But in this article that I found, college students' early academic year experiences during COVID-19 pandemic, there were some things that, well, there were 40% of the students that were surveyed in this research were Latino or Latinx. So, that's almost half of the students that were interviewed. But some of the things that they pointed out as challenges was, we all know about the mental and emotional, physical challenges of COVID, But the next thing they said was the online learning challenges that presented for them. The third was confronting the new normal. Like, what is this world? You know, how am I going to not only make sure that I'm okay, that my family's okay, but that my studies or my academic goals are going to be achieved. So confronting that new normal and just understanding the lack of positive experiences. Like I said, you know, before we were engaged in social activities, and now sports has been shut down, or getting together in clubs has been shut down or reduced. So looking at, you know, all of that, as far as when we look at our college and university campus life, how can we address those issues as well?
So the next question is, what is the state of the art regarding what works to address these needs, and or what are some models that exemplify best practices in addressing these needs in Latinx communities and campuses that serve Latinx students?
So in practice, I had to go back and really focus on models that I had already been using, but a lot of evidence-based models, connecting a lot with other people in the field who, again, had worksheets, information sheets, things already translated, or we had to come together to get resources. So I'm thinking of things like trauma-focused cognitive behavioral therapy, right, which can be done in Spanish. There's formal training that is in Spanish. Things like attachment models, right? We're talking about the family being together. Now the kids are home all the time. And things like MATCH, which is a modular approach to trauma and conduct, things like that. And anxiety, because those are the things that we were seeing, a lot of anxiety, depression, isolation. So that's what I found useful during that time and still continue to use.
Thank you.
And I'll add a little more from the research perspective and thinking about university settings and how university settings are in this place that they can make huge change, because there's certain models out there. I found a few of them. I'll highlight one from the University of California in San Diego, in which they have a no-cost community clinic that is made with the social justice and economic justice vision in mind, that allows people who are not insured to receive services, but they're comprehensive, not only related to their mental health, but medical health, dentistry, access to law students, because we're thinking about immigration concerns for people in our communities. But really using a model like that, that allows a training ground for future counselors to continue to work, and mental health providers to continue to develop their ability to be flexible and also operate from a point of solidarity and understanding that though everyone is being impacted, we are all in it together. So finding a way to communicate that to the population to engender some trust, and also making sure that if you don't have, as a site, university settings specifically, they tend to say, well, we don't have Spanish speaking providers. Well, find translators who are warm, who are able to really engage in that conversation and are really willing to be in that process, you know? So there's resources like that, that universities and other settings tend to hide behind and say, well, we don't have the providers, it's a shortage. There's not a shortage of translators. Or even relying on promotores, promotoras. So those are promoters, people who are members of the community, who are trusted by their communities to come into the communities and talk about the services that you're offering so that they could be a bridge. And oftentimes these promotores are previous clients who have gone through the, you know, the clinics, and they know what goes on in there, and they're able to really bridge the gap and communicate. And run the groups with them, and they're volunteers. So really engaging in this community partnership that encompasses different departments, different services, so that the community as a whole is served, including students. So I saw a question in the chat a little bit, but thinking about what Noel was talking about, we have a few amount of sessions. After that, we're, referred out. How about you're referred to a center in the university setting that is made this way so students have access and they're still feeling a sense of family and community. So those are some of the things that I was thinking about. And just to add one more thing to what Jocelyn was talking about, like telehealth is important, but a lot of families don't have access to it. When we're thinking about COVID, everyone's like, well, telehealth, there's no space. You don't have privacy. People don't know how to use the technology, and it takes a lot of time. So being creative and finding available space, if you're in a university setting, for example, using a classroom is a private space, using, in the article I found, they really talked about using like a corner in a chapel to be able to see their clients, to make sure that they're there, getting the support they need. But you have to be creative and you have to be flexible to meet the needs of the population.
Yeah, and when I think about evidence-based approaches, right? The agency where I was the clinical director before I came to University of Hartford, I worked really hard to look at, we work well when we're working in community and in almost like this family-like environment, right? There's a lot of trust that you can build with your provider. So kind of this interdisciplinary approach. And I know when we talk about interdisciplinary approaches, we think about just the clinician and the psychiatrist, right? But understanding that if you can have a psychiatrist who speaks Spanish, the clinician who speaks Spanish, and then attaching a case manager that can do all those additional that are very important parts of overall treatment, right? When you think about Maslow's hierarchy of needs, and people need safe housing, they need food, they need all those important factors in order to have overall health. So attaching a case manager, and then even attaching thinking about the pharmacy that clients use if they have any kind of medication management. So I was able to include that approach of a psychiatrist, the clinician, the case manager, and even the pharmacy that spoke Spanish and even delivered medication, and that driver or the delivery person also spoke Spanish, right? And having also a VNA embedded in that process. So when you think about evidence-based approaches from a community perspective, I think that's the best way to meet the overall needs of our family and in our communities.
I'll just add one more thing. So when we think about evidence-based practice, I also have to, I'm very cautious. I use it obviously, but I think that we have to think about what evidence-based means and where it comes from. And it comes from this Western white perspective of it works here. So a lot of the times when we are trained as counselors, social workers, we're trained to work with white communities, and then we have to find ways to be creative and adapt it. And then there's some research that there's an article that supports that. So I think it's important for us to, as practitioners, to be able to adjust to what our clients need and what they are thinking about. So I think I'll share it later, but there's this article, again, the one with the San Diego clinic, in which they really talked about how there's an empowerment group that they run, and they run it with the volunteers, but they also empower the members to share their ideas or projects that they think are going to be helpful in that group, so that they create that sense of community that they're missing from being in person or whatnot. So I think it's really, really important to make sure that we stick to what our clients and our population needs, because a lot of the times evidence-based is not thinking about Latinx communities or the marginalized communities too.
To build on those observations, Kirsis, I guess the research professor in me wants to make the distinction between evidence-based interventions or treatments and evidence-based practice. Evidence-based practice is the process, as you were suggesting, of partnering with a client and identifying their problem and the best evidence for treatment approaches that might address that problem. Whereas evidence-based treatments or interventions are the manualized interventions that have been proven to be effective and are adopted by agencies. And there's a lot of investment in training people to use those interventions, but one size does not fit all. And so I think that there's a real tension there, and there's often a conflation of those two terms together. So I want to emphasize that, and I wonder if Jocelyn might have a sense, because I think you're very grounded in some of those interventions, and also the the art of partnering with clients to kind of address their needs and to make modifications that are also culturally adapted. So I wonder if that's too much there, but I wonder, Jocelyn, if you might respond.
Yeah, so I think that was the benefit of having done some of these evidence-based treatments, the trainings, having done them in Spanish, right? There were things like, so much of these treatments sometimes is focused on gathering data, where you can see the differences, right? A big part of our culture is storytelling. So whereas I might be able to ask someone a question and kind of get through the form in 15, 20 minutes, if I ask you a question, it might come out in the form of a story, which I understand, but other providers may not understand it. So it's navigating, how do you answer the questions? How do you understand that maybe there has to be adjustments made to these models? And like you said, tailoring them to fit the family and the client's needs versus just to gather the data and implement this model.
Noel, would you like to follow up on that?
Yeah, no, so there are a lot of great models. When you think about trauma, right, there's like 43 evidence-based models just to treat trauma. So there are really great models or evidence-based models, but then it has to translate into how applicable it is, how acceptable or how comfortable it's going to be with the families that we're working with. So, I'm really big on EMDR, right? TFCBT, EMDR, but EMDR is also in Spanish. But there's a way to train. There's a specific training called EMDR in color, right? Which kind of brings in those perspectives of working with the Latinx and African American community. So, there are really great, when you think about evidence-based models and then practices, is you have to be able to convert and really understand, because when you look at the ACEs study, right? The ACEs study was done primarily with, white Caucasian research participants, but it doesn't take into fact that, what are the impacts of adverse childhood experiences if a child is living, let's say, in an urban environment. It really doesn't really count or capture that. So there might be, instead of 10 questions, I would add 11th one, right, to the ACEs study to capture that kind of urban exposure up to, adversity.
Thank you. So the final question for the panelists really is inviting you to kind of reinforce some of the things that you've already said, but what resources do we need to completely address the needs of Latinx communities, both in urban communities, I'll also add rural communities, and on campuses, within higher education? What obviously we've identified some useful models and approaches. We know that there's great gaps. How do we fill those gaps or address those gaps?
I think that as far as when you look at university and college campus environments and resources that we have, at the University of Hartford, we have a great psychology and PsyD program, and we have, the ability to not only educate and train future clinicians, but maybe thinking about having kind of those on-campus clinics, right, that Kirsis was talking about, where we can utilize the very resource that we're, kind of sending out for, clinical practicums and internships, and have, maybe reserve some of those placements within the college and university campus environment to be able to allow for greater access for our student population. And that's from that kind of university level. And when we think about our community level, I sit on, it's called the State of Connecticut Behavioral Health Partnership Oversight Council and Committee on Diversity and Equity and Inclusion and Behavioral Health. Try to say that 3 times in a row, right? But one of the things that we're looking at is, okay, we're educating future clinicians of color. We don't have enough of, right? But let's say, as far as university and college education and training of future clinicians in the field, now they go out and there's a barrier for them to be able to eventually get fully licensed to practice. So looking at those barriers that are getting in the way, like the requirement within 90 days, let's say for an MSW to get their LMSW, and if you don't get your LMSW, then you can't get hired at an agency or the community clinic, right? So some of those barriers that get in the way, because we know that there are, there is a great need. There's a lack of Spanish-speaking, bilingual, bicultural clinicians in the field. So looking at, okay, what are the things that we can do on a state, local, community level to address this lack of access of bilingual, bicultural clinicians? So, that's one way that we can look at it from kind of a university level and community level.
Thank you. Kirsis.
And I think,
sorry, go ahead, Jocelyn.
Sorry. I think to echo off of that, right, I think it's a matter of working together. I think there's so many great programs out there that sometimes we don't even know that they're available, right? Like every time I go to a meeting, I hear about a new program, a new form of assistance, a new intervention, because there's no central hub or central place where you can go request information, right? Everyone's kind of on their own. So I think a lot of it has to do with working together, doing things like the other panelists mentioned, of placing us right there in the university, right? Or how can you get transportation to other places provided to the students for services that can't be at the university? So I think it just takes a little bit of thinking outside of the box.
And I would just add, it takes a lot of money. It takes the money to be able to have the resources and make them available. So translating the resources, that takes a lot of energy and time. And I also think about this question 2 about the policy level. And Noel started to get into that a little bit, but we need changes at the policy level. How do we get there? We keep trying to advocate and working together. But I think that we could do all the work that we can and make our communities better in this community specifically, but what about the next Latinx community 3 hours from here, whatnot? So it really is a matter of finding ways to not only collaborate with big universities that have these centers and these resources, but also thinking about what do we need to do to get politicians to make these policy changes, to pass laws, or to really destigmatize mental health for our community, whether that is through a lot of commercials that have been going on and all of that. But what else can we do? I don't have the perfect answer to that, but I think it's people like everyone in here coming up with ideas and sharing them and trying them out so that we could really move forward. Because at the end of the day, it's a lot of work for just one community to try to change the system that is really difficult to change.
One of the things that we're really good at in higher education is, is talking, and also organizing events like this and conferences. And sometimes those events really do generate specific plans that are informed by the best evidence that we have, and that might bring other people, like decision makers, together. Right? I don't want to preclude that there aren't any decision makers in our audience today, but I think we that what I'm observing is that there is a need for a more robust conversation about these matters and engagement with policymakers and decision makers in terms of how we implement. So I want to make that observation before we go into questions and discussion, and also say that these are conversations that I've had with each of these panelists in the past year, particularly around the need for increasing our bilingual clinical workforce. And so I think that that's a starting point. We look forward to hearing from you all about your questions and your ideas about how we might move forward. I know that there's been a question in the Q&A box for a while, and I believe it's a student that asked if this will help students on campus. I'm assuming at UHeart, so that they don't need to travel away from the campus in order to get the help that they need. So since that's a more specific question to UHeart, I wonder whether I'll address it in terms of what I know is happening at St. Joseph, but I'm wondering if Dr. Casiano can address it at UHeart first.
Yeah, well, I want to recognize my boss, my Dean Goldenberg, as far as leading this charge. And I think tomorrow we have a conversation as far as what should be kind of the next steps to better meet the needs of our students on campus. So that's what it really takes. It takes a leader that's committed, a university that is looking into ways to improve how we can have access to our students so that they don't have those barriers of, and again, I referred one particular student, and, the student now has to travel outside of campus. And that's a challenge for her. Number one, she doesn't have the finances. So, having the ability to meet that need on campus not only will remove some of those barriers so that, just saying that you need supports, emotional supports is difficult in itself to be able to kind of get to that point and recognize that. So, eliminating any other type of barriers on a campus environment should be the way we should think about how we meet that need for our students, our student body. They are with us. A lot of our students, may not even, are not even from our community. They come from outside of the state. So, just the transition alone coming in as a college freshman, let's say, and you're coming from Florida or New York or Pennsylvania, that can be a transition in itself. So having the ability for your university, your campus, to provide all the supports that you need, not just in tutoring for math and English, but also behavioral health, is just going to allow that student to be that much more successful.
Thank you. I see we have a couple of people with questions. I'm wondering if Angel can ask your question.
Hi, it was more so a comment that I had because I was listening to you talk about with mental health needs on campus and how some people don't always have the money or the transportation to get to certain places. What I do like is in college, I've learned more about the mind, and I've thought about therapy before and different things like that, but also seeing more resources kind of in front of my face, maybe online and the social media page, I think that would be really helpful. And also having more people like who are bilingual or of color would make people feel more comfortable. So it was more so a comment that I had.
Thank you for that comment. That does speak to some of the strategies I know that we've utilized here at the University of St. Joseph in our Health and Wellness Center, where there's in our new facility, there's a space that's more of just kind of a safe space for students to gather and engage with clinical staff and interns. We also have some social work interns from our program who work there. So it's a more informal setting that, where students can engage without feeling that they need to meet with a clinician, but also where they can build relationships with clinicians who then they may follow up with. That's a strategy to kind of destigmatize that process and to broaden a set of strategies that students might utilize to address stress and isolation. So I see that my colleague, Professor Gina Rosic, has a question or comment.
Hello, Dr. De Jesus. Thank you. My name is Gina Rosic, and I originally come from New York City. And in listening to this conversation, one of the things that I reflect on is my time working in the New York City shelter system. There was a huge movement to reframe services for folks, because we had people coming from around the globe. And so we had a lot of Spanish-speaking clients, but also people who were Russian-speaking, French, Creole, etc. They had to sign forms and policies. And some of us really pushed back with the Department of Homeless Services in the city of New York that any services had to reframe language, not as a barrier, but as partnering in a person's rights. So in New York City, you have a right to shelter. I also think of healthcare as a human right. And I think that your right to healthcare is infringed if you can't understand what's going on. And so rather than, hey, let's hope we can hire people and let's see if we can ask for funding, I think the whole conversation needs to be reframed, frankly, in terms of making it a right that people receive services in the language that will help them understand and navigate and make the choices that are best for them. And then therefore, it becomes a requirement to provide that, right? So that might incentivize agencies to ensure that there are multilingual workers, depending on what the needs are in the community, and payment for translation services where you have someone who comes in who doesn't speak commonly spoken language in the community. And I think that reframing it in that way and ensuring it as part of the funding process and the billing process could go a long way towards equity.
Thank you, Dr. Rosic. Are there any other questions or comments?
It looks like we have one more question in the Q&A. Someone would like to know, are there any ways we can help as students on campus for the Latinx community?
Yeah, I think that as a student, you are more connected as far as your relationships with other peers and other students on campus. So just being able to be supportive in a way, and in recognizing when one of your peers is struggling, and just kind of supporting them and helping them in the process, right? So that they're not alone, so that they can seek whatever supports that they may need. So I think students play a huge role, right? They're probably the first ones to see, hey, my roommate's not doing well, or this person that's in this XYZ club with me is not doing well. So for you to be able to approach, not with a sense of judgment, but one of just empathy and of caring and supportive, is going to be the best way that you as a student can support your other peers.
And I would add to that, that you as a student have a lot of power when it comes to what activity go on campus. So when you're a member of a different organization, making sure that that mental health is a topic that's discussed and talked about, not only for Latinx students, but just college students in general. It depends on the focus of your organization, but making sure that that's a part of the conversation at every point of the way will help and go a long way in supporting your peers in general. And also just, approaching it from what Noel is talking about, this non-judgmental space, but also understanding that even though you think mental health services can be really helpful, some people are just not there, especially when they're from marginalized communities. There's mistrust of the people who are providers. There's not as many who look like them. So being patient and holding on to where they're at and walking with them in that journey will be helpful as well. So really being cautious of not putting your belief that mental health services are what they need in that moment, and just listening to them and try to provide resources that they could use while they get to that place. Because a lot of the times what happens is that people become turned off, unfortunately, but that's something else that could be helpful.
Jocelyn, do you have any final observations?
No, I think everyone pretty much spoke to what I was going to say. I'm available. I'd be happy to speak to anyone. If they would like to contact me individually, I'd be happy to chat with anyone.
So I'm going to ask if each of us can put our emails in the chat if people want to contact us. And I know that we'll all be happy to do so. And that we will, as a panel, be following up to think about how we might collaborate between our two institutions and engage other colleagues from the Greater Hartford Consortium for Higher Education who are involved in training clinicians to see if we can't spark an initiative that's informed by Dr. Rosich's idea of a rights-based perspective to mental health services for Latinx communities in Connecticut, and look at that more closely through research, perhaps through organizing as well. I think that I also noticed that Dr. Tejada is with us. She knows a lot about organizing, and but that's another way that students can be engaged and put pressure on institutions of higher education and government and in communities to address the needs of our communities. So with that, I want to thank everybody for your participation in our panel. Muchísimas gracias, and wish you a good rest of the afternoon.
Bye.
And thank you to all of our panelists and all of our attendees for joining us today. We so appreciate you all sharing your expertise with us and your insight. And attendees, hopefully you can take this information and move forward, especially the students, as we talked about. Your role is really important. So thank you all again so much. And everybody have a great day.